My name is Dr. Samuel Lin, and I'm here to talk about breast reconstruction. So when I talk to patients about breast reconstruction, I tell them about several general goals, things that I learned from my training both in Chicago and Houston. And so the first general goal that I talk about with patients who are considering breast reconstruction after mastectomy or for a prophylactic reason are one, to have a person be as symmetric in a bra and also in clothing as much as possible. Without bra, without clothing, one will be able to see which is breast reconstruction versus the native breast before surgery. Just based on size and shape of the breast reconstruction, the sensation of the area is likely numb. The color of the nipple areolar complex may be different than the native side. And so, generally speaking, we try to make things as symmetric as possible, but there will always be things that are different than they were before. The second thing is that breast reconstruction takes on the order of 10 to 12 months to complete, with at least 4 procedures. The first one involves usually an inpatient hospital stay. All the other subsequent steps of breast reconstruction are usually spaced out anywhere from at least 3 to 4 months to longer, and they are decreasing in terms of the complexity and the recovery. The second one usually is a touch-up procedure or an implant exchange type of procedure, and the subsequent procedures after that are ones such as nipple creation and tattooing, which are essentially office procedures, and recovery is really not a lot of time when we get to that stage. The third thing is that breast reconstruction has about a 2 to 3% of the time where it doesn't work for various reasons. The fourth thing is that when people have had radiation treatment, radiation really treats the area for cancer, but it also affects the skin, and the skin thereby doesn't heal as well as it would without radiation. So when we operate on previously irradiated skin, there's up to a 40% chance of wound healing difficulties, infections, fluid collections, the wound not healing well, and there may be openings that take longer to heal. These are typically not life-threatening complications, but things that delay the healing of areas of wounds following surgery. There are several buckets of sort of areas where there's wound healing difficulty or tougher wound healing. One is smoking, secondly is radiation, thirdly is people who take chronic steroid medication, and the radiation aspect is what we sort of talked about. The next thing about breast reconstruction is that there often might be balancing procedures that are done on the other side, the normal side, during the process of breast reconstruction in order to have things be as symmetric as possible. The most common types of reconstruction differ in terms of their length of hospital stay, length of recovery, and length of procedures. The first one being an implant-based reconstruction or tissue expander and implant-based reconstruction, whereby a tissue expander or a temporary tissue expander is placed underneath the muscle, and that takes about an hour and a half to do. There's typically a drain tube that comes out of the skin that helps wick away the fluid that will otherwise collect underneath the skin. And people are in the hospital for about 1 to 2 nights, depending on if there's a 1 or 2-sided reconstruction being performed. And we see them in the office afterwards, and beginning around the 3rd or 4th week, we start filling up the expander with a small needle that goes through the skin and finding the sort of the metal port with a magnet to start expanding the tissue expander, and that can take a process of months. And after which we then come back and exchange that temporary tissue expander with a permanent implant, a silicone or a saline implant. There are different types of implants in terms of shaped versus smooth implants, textured versus non-textured implants that we can go into, and that is pretty much a day procedure. The second procedure is using one's own abdominal tissue in sort of a tummy tuck type of procedure where it is a similar type of incision where there's a football-shaped incision made across the abdomen where that area of skin and fat, whereas in a cosmetic procedure, a tummy tuck procedure, that skin and fat is actually discarded. In this setting, it's actually used for breast reconstruction. At our center, we've performed a DIEP flap or DIEP flap, deep inferior peripheral flap breast reconstruction often. And what that means is that we take the time to dissect out the little blood vessels, through the muscle and connect them trace them back to the main blood vessel. We then make a secondary window in the cartilage, and then we bring that tissue up to the chest wall area. We reconnect the artery and vein to the tissue from the abdomen artery and vein with a microscope, and that becomes the breast reconstruction. For a two-sided reconstruction, half for one side and half for the other in terms of breast reconstruction, again collecting and reconnecting those little blood vessels. The critical time period is that first day, day and a half, to make sure all the blood flow is flowing well. 1 to 2% of the time, the tissue that we take and transfer doesn't survive, doesn't take. Correspondingly, 98–99% of the time, the tissue takes just fine. And there are typically two drains in the abdomen and a drain in the breast reconstructive area. And the recovery time for that is about 6 weeks' time. That procedure itself has really cut down in terms of the level of bulge or hernia in the area of the abdomen or the tummy, whereas in the past, the classic sort of tram flap had a hernia or bulge rate upwards of 5 to 25% of the time. And lastly, the third type of breast reconstruction that is performed most commonly is using the back muscle or the latissimus muscle, that muscle that you use to propel yourself when you're skiing or reach overhead and pull something down from overhead, and that gets moved to the front and placed over an implant. It's typically, the muscle is thin, the skin and fat is thin, so it's not typically enough volume to make a full breast reconstruction. So we place it over an implant, and so it's sort of a hybrid situation where you have your own tissue and also you have an implant underneath, and implants in general have a consideration of maintenance to them. So over a 10-year period of time, about 1 out of 5 people end up having another procedure related to the implant for maintenance. The implants in general can have a leak or have something called a capsule formed around the area, which then can bring people back to have other procedures performed for breast reconstruction. So in a nutshell, those are the most common types of breast reconstructive procedures that are performed. There are other areas that are less common but performed as well, moving tissue from various other parts of the body as well. What I just wanted to add also in terms of breast reconstruction was at the end of the day, people ask, well, what's the best thing for me? And I certainly can't make that determination for folks, but I can try to help people to get to that decision point. And I tell people that in terms of different modalities of breast reconstruction, they do differ, and they are different to have pros and cons. The abdominal tissue route, in terms of deep flap reconstruction using your own abdominal tissue, is the most durable breast reconstruction. However, the most sort of upfront recovery time. It requires a 6-week recovery time, inpatient hospital stay for about 3 to 5 days. And several weeks to sort of get back in terms of work situations and getting to feel a little bit more normal. But it is most durable over a lifetime. An implant reconstruction route is shorter. It involves one site in terms of the mastectomy as well as the breast reconstruction, certainly, but there's a maintenance to implants overall. And over a 10-year period of time, about a fifth of the people folks end up having other procedures related to the implant, whether it be in exchange for a size change in terms of the implant, something called a capsule formation around the implant that can become uncomfortable, things that you can sort of see in terms of the implant, in terms of rippling or little folds you can see through the skin. These are things that don't hurt anyone, they just look different, and people decide that they want to have other procedures to try to help the process in terms of reconstruction. I tell people who have lots of heavy either work or home obligations, who really can't take off a lot of time, perhaps they're more suited to having an implant type of reconstruction to get back to their life and their work. People who certainly are able to schedule things and find time and have the support network in terms of the family and home situation to have abdominal surgery for breast reconstruction, then they can make that determination as well. The most common types of breast reconstruction that I perform are both deep flap reconstruction from the tummy for breast reconstruction as well as implant reconstruction, with a third most common one using the latissimus muscle from the back and an implant. And so I hope you find that helpful, and we'll talk soon again.